Begin. Welcome everyone to the Canadian Public Health Association's Infectious Disease and Climate Change Webinar Series. I'm so thrilled to see so many of you joining us today. This is the third webinar in our series, which will be exploring current and emerging infectious disease topics to share knowledge, research, and best practices. And to learn more, you can visit cpha.ca. Before we begin, I want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin and Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. Today's webinar, The Climate Atlas of Canada, Educational Tools on Infectious Diseases and Climate Change, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. I'm Gillian Pritchard, Project Officer with CPHA, and I'll be the moderator for today's webinar. Just a few housekeeping things before we begin. It should be noted that all of our Zoom attendees are muted, and if you have any questions for the presenters, please type them into the Q&A box, which you'll see below. And you can do this at any point during the webinar, and they will be answered after the presentation. Only you, myself, and the presenters can see the questions in the My Questions section, and you'll also have the option to submit these anonymously. When asking a question, I will read it out and then it will be answered live by our presenters today. And if you have any questions regarding technical difficulties, please also ask them in the Q&A box. And if many people are experiencing the same problem, we will answer it live. We really strongly encourage attendee participation, and we really look forward to hearing your thoughts and questions. Just a few quick notes that our webinar is being recorded today, and it will be made available on the CPHA's YouTube channel a few days after the event. And the presentation slides will also be shared in a follow-up email to the attendees. We'd love to get your feedback, so if you could please take 5 minutes at the end of today's presentation to fill out our survey upon closing the webinar, we'd really appreciate it. And finally, the CPHA are holding an Infectious Disease and Climate Change Forum this year on October 5th, so you can please visit our website if you'd like more details. Now I'd like to introduce our speakers for today's webinar. Dr. Ian Morrow is the Executive Director of the Prairie Climate Centre and Associate Professor in Geography at the University of Winnipeg. He is a former Canada Research Chair, a Fellow of the Royal Society of Canada's College of New Scholars, Artists and Scientists, and has served on expert panels related to food security, climate change, and energy issues. Morrow's research and filmmaking projects have taken him from coast to coast to coast to help understand Canada's changing climate and its implications and opportunities. Next, we have Laura Cameron. She's a research associate with the Prairie Climate Centre, living and working on Treaty 1 territory in Winnipeg. With an MA in Indigenous Governments from the University of Winnipeg and a BSc in Biology from McGill University, her research interests are transdisciplinary with a focus on climate change communication and public engagement, Indigenous knowledge on climate change, and the health impacts of climate change. Next, we have Isabella Roebuck is a research assistant with the Prairie Climate Centre focused on the connection between climate change and health. She recently graduated from the University of Winnipeg with a BSc in Geography. Her most recent research for her thesis focused on how Canadian perceptions on climate change vary across sociodemographics. And with that, I'd like to turn it over to our speakers. You can now start sharing your slides.
Good afternoon, everyone. My name is Ian Morrow, and our team from the Prairie Climate Centre is coming from Treaty 1 territory in the homelands of the Métis Nation. We're here in Winnipeg. So thank you for joining us, and thank you for the Canadian Public Health Association bringing this together. And it's quite an amazing opportunity to kind of share the findings, share what we've been up to, and network the kind of information that we need to build a resilient Canada in the face of climate change. And so today we're going to talk about the Climate Atlas of Canada, a project, the flagship project of the Prairie Climate Centre, And we're talking about the educational tools on infectious disease and climate change. And when we speak about education, we're deeply embedded in the process of research. And so we're doing research that develops communication tools that lead to kind of these educational deliverables. And the Climate Atlas, we have to kind of give a shout out to Environment and Climate Change Canada. They've helped us develop the data and supported the project, and the Public Health Agency of Canada, who's really helped us kind of jump into the health space and the health climate interface. And all of this work supported by a SSHRC grant. And so just to give a shout out to some of the funders and to give some of that context around the work. And to jump into climate change, many of you will be familiar with this. Many of you have seen some of our presentations. I've seen the participant list. Hello to all our friends out there. And when we take a look at climate change and the changes that we've seen over, the past 100+ years, we can see with industrialization, we've had this kind of stable temperature. And as soon as we started to kind of ramp up the burning of, fossil fuels, oil, gas, and coal, the temperatures of the planet started to increase. And we can see this. This is global mean temperatures. And we've warmed, about 1.2 degrees Celsius from pre-industrial times. That was in 2019. That's increased since. And we see this curve bending up. And we've talked a lot about curves in the past 18 months or so, and we're going to talk about them in this presentation. But as carbon dioxide and other greenhouse gases go in the atmosphere, the temperature is increasing. We know this. And 2020 tied 2016 as the world's hottest year on record. And so we know that we're warming, and this has profound implications for ecosystems, human health, and human life on this planet as we know it. And, when you take a look at the history of climate change science, we've known what's going on for a very long time. When we look at the United Nations process, the Intergovernmental Panel on Climate Change, in each successive major global report, we get greater certainty that humans are causing climate change, and we get greater certainty that there are serious impacts. And the questions that we have at the Prairie Climate Centre is, why is this information, this science, not connecting into dramatic policy shifts? And for us, it's a climate communications issue. We have trouble communicating this in a way that changes policy, that transforms society. And so we're interested in that kind of research policy communications interface. And if you take a look at the images on this slide, many climate communication scholars in this emerging field of climate communications are saying that we need to start looking at, these different processes from psychology and sociology to kind of political science and how communication works of science through all these different lenses in society, and how do we frame information for different audiences so that they see this issue and internalize it and making it meaningful to them. And so we practice this in our work and in our research, and you'll see how that plays out in some of the co-presenters here. And so when we built the Climate Atlas, it actually started as a Prairie project. And when we cracked that nut, when we realized, oh my goodness, this is a really important interface, this interactive ability to click in and look at data, we decided immediately, let's build a national project. Let's build a national tool. And this is part of a continuum of portals with Environment and Climate Change Canada and the Canadian Centre for Climate Services. And there's a climatedata.ca portal as well. And these are kind of sister portals that get this information and mobilize it for Canadians. And so we're interested in making sure Canada has access to this data. There's global climate models, there's interviews, there's all these things inside the Climate Atlas, and I'll show you a quick sneak peek of that. So if you click into the Atlas, you get this grid squares of a map of Canada, and you can click into any location in the map to get climate data for that precise location. And you see the play buttons. Our team has been making videos about climate impacts across the country for about a decade, and we're starting to populate the map, bridging social science and climate science. And we say, climate science and storytelling, really trying to figure out how to get the information out in a good way. If you take a look at the bottom, there's these sliders, less and more climate change in different time periods with different variables. And so there's a whole bunch of information that can be visualized through this map. Right now, we're looking at the number of plus 30 days in a high carbon kind of medium future. And if you slide on the Climate Atlas to the right, a high carbon future in that future time period of 2051 to 2080, you see the map kind of go red. And again, the number of plus 30 days is what we're looking at. And if we click on a location, so we're in Winnipeg, as I mentioned, the number of plus 30 days in Winnipeg in that high carbon far future jumps from about 14.3 on average in the baseline period of 76 to 2005 up by almost 40 plus 30 days for an average of about 52 plus 30 days in that high carbon far future. And when we think about that, you know, we're like, oh my goodness, almost 2 months of plus 30. And that's the average. That's that black line going through all the climate models, the red bouncing up and down. In the extreme years, it could be much more than that. It could also be less than that. And so it's important to look at the variability there. But in a sense, we know the system is warming up. We know this is going to bring a lot of change. We know there will be health impacts. If you scroll down in that field, you can see all these downloadable tools. And so there's reports for Winnipeg. There's model data that you can download. There's the historical data. There's graphs. There's maps. And all of the information that you need for any location in the country to start really thinking through what climate change means, not just for plus 30 days, but all the various variables inside the atlas are there for you. And so go check it out, take a look. And that's at climateatlas.ca. Our team is a varied one. I just want to give a shout out to all the team members at the Prairie Climate Centre. We've got climatologists, filmmakers, you know, community-based researchers, Indigenous-focused researchers. There's lots of folks out there, and health researchers. And so when we look at the work, when we bring that all together, we released in 2019 a heat waves and health report looking at the number of heat waves in the country and looking at how that will look in that 2051 to 2080 time period in different locations and in places where you never thought there'd be a heat wave. There will be one. And it helps us to start thinking about that future so we can respond and move towards that adaptable, resilient future that we know we need. And with the help of Health Canada and the Public Health Agency of Canada, we were able to launch a health topic. And so if you take a look and you go to the Atlas, there's a drop-down menu. And if you go to topics, you can see that health is there. And when you click on health, with the support of these groups, we've been building out this health topic. And so there's a lot of information there. There's maps, there's data, there's case studies, and we've got a surprise for you today, which I will let Izzy talk about in a second. But essentially, we've been developing these videos and linking it with data. We've been talking about aeroallergens. We've been talking about wildfire water and the interconnection between these things. And so there's a lot of resources there when you're building conversations, when you're having, you know, a presentation, when you're working in community. But this is also that research kind of community interface. There's a lot of high resolution information in here. And, you know, the overall objectives of the Public Health Agency of Canada funded project, Stories of Health and Hope, was to really bring that science and storytelling together to look at these different kinds of knowledges, to develop and support monitoring, communications, and solutions across local, regional, and national scales. And so we're a number of years into this project, and we're going to show you some of the exciting things that we've developed. And the process is around engaging experts, professionals, and communities. So we've interviewed Public Health Agency of Canada scientists, other academics, but also working in community, talking to people, you know, on the ground who have been affected by infectious disease and climate change issues, and practitioners working in that space. And on that note, I'd like to introduce Izzy.
Hi, everyone. Yeah, like Ian said, we create these public documents on climate change and health, in particular to communicating climate-affected infectious diseases. Some of the current content that we have are Lyme disease, mosquito-borne diseases, and water-borne diseases. So these all have an article and a corresponding video. I started last summer as a student working on my undergrad at University of Winnipeg. And I took on the project of waterborne diseases and climate change. We're really excited to announce that it is launching today, both our article and our video. So it was great to be a part of that, working with the Prairie Climate Centre, to be a part of engaging with experts, professionals, and community members, as well as just having the opportunity to be a part of this critical education on climate change and health, and being a part of that and bringing this content together. So to look more closely at the waterborne disease content, so on the left here, we have a little screen grab of our article on the Atlas. On the right are those who we have interviewed for this content. So the article, looking at waterborne diseases across Canada, there's a lot of waterborne diseases that we can focus in on and talk about. So to frame it for the public, we spoke more just to bacteria disease outbreaks more generally, as well as harmful algal blooms and the toxins that can be harmful to the public. So we focus in a little more from there, looking at Lake Winnipeg. Being from Manitoba, we're aware of the water quality issues that surround Lake Winnipeg, as well as specifically to harmful algal blooms. So our video, Hotter Summers, Greener Lakes, looks more at algal blooms on Lake Winnipeg, whereas our article is more general. And so we are looking for diverse forms of knowledge, and we came across Chelsea Lobson, Ian Young, and Becky Cook, all who have very strong scientific backgrounds in their fields. So Chelsea Lobson was able to talk to us about the Lake Winnipeg watershed and what contributes to that water quality on Lake Winnipeg. And Ian Young was able to talk to us more about the health risks associated with waterborne diseases, specifically to using the water recreationally. Becky Cook also has a really strong background and understands the degradation of this water body very well. She also grew up on Lake Winnipeg in an Indigenous community, a fisherman on Lake Winnipeg. So she was able to tell us about her experiences and the observations she's made growing up from being young to bringing it into her career now. So again, like Ian mentioned, bringing together the science and storytelling into this content to make it really effective. You can also see here, we normally like to engage with these individuals by meeting them in person. You can tell 2 out of the 3 were done through video calls, as we're really familiar with within this last year. We were lucky enough to talk to Chelsea Lobson in person, but yeah, so like I said, that's brand new, just launched today. We encourage you to take a look at that when you have a chance. We also have our mosquito-borne disease content, follows a very similar framework. We also had Puneet Sandhu from Maples Met School. So she's been working with Prairie Climate Centre for the last couple of years. She also had a part in creating this content. Again, we have background from scientists on this content, and we also followed the story of an individual named Chris who contracted West Nile virus, and he was able to tell us about his experience. He just took a visit to a cabin like many of us do in the summer, and came back and told us about a story with this illness. And so it's a really strong aspect of this content for readers to be relatable, that this can happen to anyone and we're all kind of at risk for this. And as important as it is for us to communicate and emphasize these connections in climate change and health, we also want to give readers a sense of hope, that there is adaptations that people can make to their health behaviors in order to prevent these certain illnesses, whether it be waterborne or preventing being bitten by certain like ticks or mosquitoes. But at the end of the day, it's about reducing climate change if we want to mitigate these diseases. And so we provide resources for individuals to be able to take action on climate change to reduce these long-term impacts of these infectious diseases and other health risks.
So I'll pick it up there. Thanks, Izzy. And yeah, the last bit of content that we have created around infectious diseases and climate change within the health topic on the Climate Atlas pertains to Lyme disease and climate change, which we know is a priority area for the Public Health Agency, as well as other folks working on infectious diseases across the country. And so we reviewed the literature in this area, and we also conducted interviews with folks from the Public Health Agency, doctors, as well as affected community members, and created materials including this article, a short video, and a series of maps, which are all found on the Climate Atlas. The maps show the projected or expected potential range expansion for the habitat of the black-legged ticks, which are the primary sort of vector of Lyme disease in Eastern Canada, looking into the future under future climate change. And these materials are aimed at the public, obviously talking about the risks of Lyme disease, how it's affected by climate change, as well as actions, adaptive measures that we can take individually and collectively to mitigate these risks. And so with these materials all together, we're not only interested in sort of putting those out to the public to help inform people of the risks around health and climate change, but we also want to engage them in getting feedback and evaluating how effective are these risk communication materials, because we know from the research on climate change and health that there's actually it's a very emerging field. There's quite little understood about how people respond to materials around health and climate change, specifically in the Canadian context, and what are the best practices here. So this is a field that we have been working in the last couple of years. The first project that we sort of undertook to evaluate these risk communication materials was a series of focus groups in southern Manitoba. So you can see the map on the left. We conducted 6 focus groups, 2 in each of these 3 communities, which sort of span a continuum from more urban to more rural in southern Manitoba, in Winnipeg, Brandon, and Morden Winkler. This region is pretty interesting with respect to Lyme disease because black-legged ticks have emerged more recently in the last decade or so in the province and become established, but we've had ticks, other tick species such as wood ticks, here for a long time. So it's quite an interesting context to evaluate health perceptions around Lyme disease specifically. So we conducted these 6 focus groups, and you can see in the table on the right that we divided the groups into low and high climate change concerns. So in the pre-screening questionnaire ahead of the focus groups for recruitment, we asked people their concern about climate change, and we segmented them into these groups to get a bit of a higher resolution into where different audiences across both the urban-rural spectrum as well as the climate concern spectrum and how they're perceiving these issues. So out of this research, we have had 2 papers recently published, which are up and available online. So the first one you can see here pertains to public perceptions around Lyme disease and climate change, as well as the relationship between these 2 issues. Generally, we found quite a wide range of knowledge on both climate change and Lyme disease. With respect to climate change, the public generally, or participants generally, had quite a superficial understanding, and in some cases sort of a misunderstanding of the issue, kind of conflating pollution and greenhouse gases to some extent. Participants in high climate concern groups were found to have greater knowledge on climate change, higher perception of risk, and less skepticism compared to those in the low climate concern group, somewhat unsurprisingly. And across these groups, we found evidence of psychological distancing, both temporally, socially, and geographically, which again is sort of a phenomenon well documented in the literature. With respect to perceptions of Lyme disease, we found that most participants did not have a lot of knowledge on Lyme disease. Some people did have high awareness of the disease, and those were mostly people who had known someone personally to have experienced Lyme disease. But the majority in general were not really worried about the risk of Lyme disease to themselves and their communities. And there was an expression across all of the groups of a lack of knowledge on the disease and the need for more education, both among the public as well as among the medical community. And so we looked at how perceptions relate between climate change and Lyme disease. And we found that these perceptions sort of vary independently. So just because someone has a high risk perception of climate change doesn't necessarily mean that they perceive a high risk of Lyme disease, and vice versa. And so this we proposed this model that you'll see in this figure, which shows a potential relationship between Lyme disease and climate change perceptions. And we think it's useful just in informing or thinking through risk communication strategies that we need to understand and take into account where our target audience is on both axes of risk. So to account for both climate opinions as well as health perceptions of the audience. Yeah, in which ways skepticism sort of in the ways that skepticism arose in discussions around climate change, especially around Lyme disease, especially when it was linked to climate change, we suggested that perhaps sort of breaking these issues apart and decoupling them in some contexts for specific audiences, particularly those more skeptical of climate change, might be more effective in communicating with them. And so the second paper really dug more into the participants' responses to the materials that we made. So we showed them initial drafts of the materials, the article, the video, as well as the maps, and we got their responses on these materials. And in general, we found that across groups, the material with the best response was the video. This was, again, about a 6-minute video with interviews from experts as well as an affected community member who told his story of having Lyme disease. And yeah, I think what really resonated with people was sort of this narrative and storytelling aspect, and particularly this main character who is just sort of an everyday person, someone who's really relatable to this audience and is from southern Manitoba as well, telling his story about how he contracted this disease and hadn't really thought about it beforehand. On the other hand, we, in response to the maps that we showed people, generally there was some confusion. People found the maps more difficult to understand, and in some cases more alarming, particularly the coloring that was used, the sort of red indicating higher temperatures into the future. And so the results in general, we found that perhaps it's a continuum of moving from like a video to text-based materials to a map might be more effective in terms of communicating sort of pathway for audiences who are less familiar with this content. And so in the paper, we also sort of looking at particularly the feedback that people were confused in some cases about what the goal of the goal of these materials is. So we suggest that it's important not only to think about the goal of the communication of the materials, but also the audience's level of concern about climate change, in order to inform how we might operationalize a framing of health, like a health framing in climate communications, particularly around this issue of Lyme disease, but perhaps more generally for infectious diseases and climate change. And so if our goal is to motivate health adaptive behaviors, to get people to tuck in their pants and use bug spray and take all the measures that they might to prevent coming in contact with the tick, or is our goal to motivate them to be more concerned about climate change and support climate mitigation behavior? Or is our goal to increase public awareness of the link between health and climate change? And in each of these cases, we suggest certain specific recommendations for communicators with these specific goals in mind. And so with the information from the focus groups, with those results, we modified the materials that we had created. We created a new map showing a potential or a pathway for climate action and how that might affect or lessen the risk of Lyme disease into the future. And we also re-edited the video to add in some pieces of content that were specifically requested by focus group participants across groups. And those final materials are up on the Climate Atlas now. And so from these focus group results, we saw a need to better understand the application and suitability of how do we apply a public health framing of climate change communications in Canada more broadly. And this led us to undertake a national survey looking at public understanding of the health impacts of climate change. And so the objectives of this survey were to understand to what extent the public is aware of the link between climate change and health, including infectious diseases, to understand how concerned people are about the health impacts of climate change, and specifically which impacts are most resonant or of highest concern, as well as how do Canadians, again, respond to different framings of climate change information. And again, we were testing sort of little pieces of materials that we had created based on the Climate Atlas. So this survey sort of fits into a national and international emerging literature around better understanding public perceptions of the health impacts of climate change. So Health Canada has undertaken a few surveys over the last decade looking at similar themes, as well as groups in the US and more internationally are looking at how people understand this connection between climate change and health, but it is quite a new field of study. So in this past December in 2020, we conducted a national survey in collaboration with Nanos Research of just over 3,000 Canadians with geographic representation across the provinces and territories that allow us to look to compare between sociodemographics and regions to get some more resolution of how people are understanding the health impacts of climate change. Specifically, the variables that we measured were pertaining to climate change, around belief, certainty, concern, and so on, but also the focus was really on the awareness of the link between health and climate change, people's affective assessment of the health impacts of climate change, so how, whether people perceive climate change to be good or bad for health, people's unprompted knowledge of the health impacts of climate change in response to an open-ended question, their relative concern about various health impacts of climate change, including several questions specific to infectious diseases, and the response to map and text materials that we made. And so the analysis of these survey results is ongoing. It was quite a large survey, 116 questions, so it's taken us some time to sort of digest that, but we hope to begin publishing those results within the coming months. We just included one initial survey figure in this presentation, which just shows that overall we see that even amidst sort of the pandemic, when we conducted this survey in mid-December, sort of in the midst of the second wave of COVID-19, we see that climate change still remains a very high concern for Canadians, with 65% rating their concern 7 or above out of 10. And so with that, we have this sort of research ongoing and other educational resources and tools forthcoming. And I'll pass it back to Ian to say a bit more about that.
I just want to thank the team for great presentation so far. And as we wrap up the project, we are going to continue to kind of do the knowledge mobilization part, where we're moving the things that we've learned onto the Atlas, but into these forums like webinars, developing animations, the educational resources, and peer-reviewed articles. And so that's how we plan to wrap up this phase of the project. We've developed a series of guidebooks for educators and professionals through the history of the Climate Atlas, again, trying to create usable, not just useful, but actually usable tools for the various audiences that we work with. There's a couple examples of the things that we have here. And our plan is to develop a bit of a roll-up for the whole project that will summarize things that are on the Atlas, create the links and the ecosystem of content so that it's in kind of one place and you don't have to necessarily go fish around the Atlas for all these different pieces, although we encourage you to do that, especially today's launch of the infectious disease material that we've put out. And so we plan on kind of having a wrap up in this way for the project. And, it's important to kind of take this work in the larger context. And the Canadian Institute for Climate Choices, I'm on their adaptation panel. They just launched this report, The Health Costs of Climate Change. And one of the main, findings is that Canada has a substantial deficit in health-related adaptation. So we really do need to start figuring out how to lock in a systematic way of adapting in the health sector. There is a national adaptation strategy being developed right now. There's some huge opportunities to kind of link these various initiatives initiatives to ensure that we are kind of working from, a place of strength and a place of evidence around how we move forward. And our work really does look at that kind of evidence-based approach to communication so that we are hitting target audiences and we are moving the needle. And on the top right there, the report from Climate Choices looks at projected health costs, and they looked at Lyme disease, ground level, ozone, health-related, heat-related deaths, productivity losses. And you can see Lyme disease is kind of a small cost in this larger suite of issues. And so we talked a little bit about Lyme disease. It's important to take a look at, these larger issues and these ballooning costs as a whole. And that's that kind of One Health approach, looking at the big system of potential impacts. One of the things the report looks at, and our group has also looked at, is the mental health impacts of all of these issues cumulatively. And when we look at all of this stuff, there are some pretty serious concerns on the horizon, and certainly speaks to the need to being prepared and linking our approaches nationally, regionally, and locally. To kind of zoom back out to the macro, the Global Risks Report by the World Economic Forum that came out this year in 2021, they did a risk assessment based on, their community of people at the World Economic Forum, looking at the likelihood and impact of various risks across the country. And if you take a look at the top right, the highest likelihood, highest impact, infectious disease and climate action failure. And so we are in a moment where these things are amongst the highest priorities in society. As Laura's slide showed, even in Canada, people view these two things as being equally important. And so we have an opportunity to kind of create alignment right now around climate and infectious disease in a way that we've never had. And I think the pandemic really does open up, as Aaron Duddy-Roy talks about, pandemic as portal. When we take a look at, McKay's cartoon, which this has been circulating the internet, COVID-19 is this first wave, the economic impacts, but behind all of that is climate change. We have an immense surge of potential impacts that are going to hit our communities. And we need to be looking in that integrated way, in that holistic way that moves evidence into action. It is absolutely imperative that we understand the waves that could be crashing down on society and that we respond to them. And to leave on a slightly optimistic note, over the past, number of months in the pandemic, we've been talking about bending down.
Appears we might have lost Dr. Morrow there. Did either one of our presenters want to jump in?
Sure, yeah, he's fully gone, and we lost our slides as well. Okay.
Shoot. Oh, I think he's coming back.
Can you hear us, Ian?
I'm so sorry. Yes, I can.
Okay, I think we lost you.
We obviously lost me. I don't know what happened there. Anyways, we will, for the benefit of the recording, I'm going to start this slide again. And sorry, everybody, the pandemic and all of these situations kind of crashing down on us. So, for the past 18 months, we've been talking about bending down the curve, from grandmothers and school children, thinking about the COVID numbers and how we, get this kind of, issue abated and we create system capacity. This idea of bending down the curve of COVID numbers is the same message around climate change. We need to bend down the curve on emissions. We need to figure out how to actually create an opportunity for emissions to come down to kind of give us the ability to respond and be resilient. And so we're at a time in society where, scientific literacy is perhaps at an all-time high around these issues. And we actually have an opportunity, if we use our communication properly, to kind of transition out of COVID into a conversation about climate change that builds on this momentum, where we have, chief public health officers, in alignment with, the prime ministers and presidents of countries saying we need to be evidence-based. We need to take this seriously. And so I'm really optimistic that the transition from COVID to climate is going to be one where we actually, get ourselves in check and figure out how to use evidence, communication, and action to actually get us where we need to be. And so on that note, we thank you, and we certainly welcome questions.
Well, thank you so much to the three of you. That was a wonderful presentation. Nice to end on an optimistic note there. So now for all of our attendees, you're welcome to ask any questions to the presenters in the Q&A box below. So you can just type those in, and then we'll be happy to read those out and have our presenters answer them. All right. And just please note that our webinar is being recorded, and it'll be available on our YouTube channel after the presentation today. Just 1 second here. We'll just give a minute for people to type in their questions. And I'll just share my screen back. All right, I think we've got our first question here. So there's really two questions. Have you distinguished between waterborne and water-based organisms, i.e. Sprazoic protozoonotic organisms like Legionella, or perhaps more broadly than bacteria, parasitic organisms like Nagellariasis or sorry, it's challenging me, ochinosis, and how do these infections might change in prevalence?
Yeah, so I guess I could take this question on. When looking in literature and research, and even talking to Ian Young, who was an assistant professor, School of Occupational and Public Health at Ryerson University, it can get really complicated material in order to present to the public. So we want to translate that information, although it can be, like you said, there's waterborne, water-based organisms. We kept it very general and focused more on environmental conditions that more generally support waterborne diseases. It's more about contamination of the environment and the precipitation and warming, and how these organisms are more supported by the environment, more suitable for them to grow in. So we want to keep it very simple. I'm not an epidemiologist. My background's in geography and climate change. And so we talk to these experts and professionals, and we want to translate that knowledge so that it's more suitable for the public. And so by getting too scientific, it can lose some of that understanding. But overall, there is an increase in infections that have been seen, and in their modeling, they're hoping to be able to predict this better, but also I lost that other point there, how these, yeah, so in literature and research, it does expect these to increase. And so that's why we wanted to shed light on this problem. But also the problem with these infections is a lot of them relate to foodborne illnesses. So there is an underreporting of infections. And so hopefully by bringing awareness to the risk of waterborne diseases, it'll also increase kind of the data that we have on number of infections as well. I hope that answered that.
Yeah, thank you so much. So we've got another question here. Regarding the focus groups in southern Manitoba, many farmers in the area relate climate change back to normal or typical cycles of weather. So do you hear this sentiment during focus groups?
Yeah, I can answer that. Yes, we certainly did hear some of that sentiment from the focus groups. And, you know, we sort of asked people initially their concern about climate change, and we segmented into those groups. So to some degree, we heard in the low climate change concern groups, more of those sentiments of that climate change is sort of a natural cycle, or some element of skepticism. In general, there was, I would say, almost no sort of outright denial of climate change not existing at all, but there was definitely sort of threads of sort of this talking about climate change as normal or cyclical, and often quite like a spectrum, I would say, of belief between sort of denial and certainly it's anthropogenic, and people sort of find themselves in the middle, saying that, oh, maybe people have something to do with it, but it's actually mostly sort of cyclical or mostly a natural thing. So you could see people sort of working that out in the discussion amongst themselves, and often in some cases even saying like, oh, I think it's like 20% human cause and 80% natural, or so there was people often yeah, who have those views around like this is a cyclical natural thing. Also did sort of in some cases concede that we do have, humans are having some impact. And yeah, I think an interesting aspect as well was that with Lyme disease, we also saw sort of a parallel in that cyclical natural argument that Lyme disease is also sort of cyclical, and we know that ticks come in sort of waves, and some years they're really bad and some years they're not so bad. And there's all these other factors influencing Lyme disease that don't have anything to do with climate change. And so those who were more sort of skeptical of climate change found these other reasons of why Lyme disease might be varying in these cycles as well, to point to. So the parallel there was quite interesting.
Maybe I'll just make one point. You know, there is, in this context of communication and health framing, you know, there is this kind of idea that if you combine a climate and health message, it has better resonance. It actually kind of attaches to people in a more significant way, because health is a personal issue as opposed to climate change, which can be perceived by some as this kind of thing that's out there and external to them. And what this research, especially on the Canadian prairies, where we know there's high climate skepticism in certain pockets, you look at Eric LaChapelle's work that maps public opinion, we know that to be true. And what we found is that, you know, we have to be careful about just assuming that that's going to work with all audiences. And so the work that Laura presented on this idea of audience segmentation, and if there are these climate skeptical audiences, having very different kind of approaches and not assuming that the health frame is always going to work when attached to kind of climate change in that way. Because what the danger is that you have people who are already adapting to climate change, you know, rural people actively on the landscape, and you bundle climate change with this health message, and all of a sudden there's a possibility you kind of throw the baby out with the bathwater, in a sense, where it's like, oh, well, you know, we don't want to talk about climate change, so we're just going to, you know, abandon all kind of health ideas at the same time. So we have to be very careful, and that's part of this work, is to really trying to understand exactly the nuances of how kind of climate information connects to these different audiences or does not connect. And so that was that idea of this strategic decoupling, the case for strategic decoupling.
Okay, that's really interesting. We've got another question here from a climate research student from PEI asking, how should we combat rising Lyme disease cases with higher temperatures and humidity and make people more aware of tick habitats and dangers of tick bites? Do you have any resources on numbers of Lyme disease cases throughout Canada?
Yeah, I think, so to first say, we aren't Lyme disease experts, we are climate communication enthusiasts. So sort of our work is more in translating that knowledge to the public, and then like understanding how they're receiving it and feeding it back into these risk communications. As far as the Lyme disease numbers across Canada, I do believe it's Health Canada or someone is collecting that that data. And there's also, I'm sure you're aware of, the website eTick, which is sort of a participant-driven website that I believe is expanding into the eastern provinces. As far as making people more aware of tick habitats and dangers of tick bites, I think what we found in our research is the need for more really kind of direct, simple, and kind of myth-busting information, educational resources around Lyme disease, because there was people's perceptions and the understandings that were coming out of the focus groups didn't always match up with what the literature, what experts are saying around Lyme disease. Many people had this characterization of the disease as chronic and as some symptoms that weren't quite what experts say that this disease is. Actually, people from, I think, 5 out of 6 of the focus groups reported that they had known someone to die from Lyme disease, whereas experts say that this disease is often not very, it's very rarely fatal. And so these sort of, there is definitely controversy around the disease. And I think information that meets people sort of where they are in their in their context and is very clear to the point and sort of addresses some of these misconceptions that come up would be effective. And I would encourage you to look at that second paper that we cited, which gives a bit more detailed information about what people found liked and disliked about some of the materials that we use, which might be useful. Of course, the context is different in PEI with a different audience, but some of those findings might be transferable to your region.
Thank you. Got lots of questions coming in. This is great. So we've got one asking, how would you like to see your work on the Climate Atlas and climate and infectious diseases being taken up in K-12 schools? Are there specific approaches you have seen to be effective? And what should we be hoping that school kids come away from this learning?
I'll maybe take a crack at that. So one of the exciting things about the Climate Atlas is that we do see like a surge of use in like September and a slight decline in use when the school year wraps up, and we actually can monitor usage. And sometimes we'll see like schools like literally like 50 kids all on the Climate Atlas in one place at one time, and it's quite neat that it is kind of this tool that's being used by schools. And we actually have a number of partnerships with kind of educational organizations to do that kind of deployment. Our team has done numerous workshops for professional development days for teachers and getting the information out there so that, school age kids are hearing it from their teachers and making sure that the information is being translated and communicated in those good ways, in those evidence-based ways. I think that, as a parent, climate change is an existential threat. And I, as someone who works in this space, I have trouble talking to my kids about it sometimes. And I'm still trying to figure out what's the language, what's the right approach, what's the right level. And we have to be really, really careful that we don't kind of project a future that causes paralysis, that has people freeze up and not sure how to act. And so, I think, this is a personal opinion. It's not kind of research that we've done, but we have to create an opportunity for people to see a positive future. And we have to create a pathway for that to be realized. And so, whether or not we're kind of professionals in our, academic or kind of government setting or wherever you are out there, ultimately, I think the path forward is one where we can see and realize and visualize a future, and we work backwards from building that path. And I think the global youth movement, we've seen young people literally demand, structural change that allows for the vision to be realized by a concrete path to get there. And so, it's slightly kind of vague in a response, but I think that's our ultimate goal is holding space for a truly livable, successful, and resilient human future, but work backwards from a path. And we have to give young people an opportunity to see that it's not aspirational, it's actually doable.
I would maybe just add to that from the work that we've done through this project so far over the next year, in the final year of this project with the Public Health Agency, we're planning to create curriculum around these materials. And so we'll do that by sort of surveying the curriculum in sort of middle school, high school likely, and seeing where these resources might best fit and creating sort of learning modules around those. And just to give a shout out to the Canadian Public Health Association folks who also did, I'm not sure if you're familiar with the poster contest that they had for grade 6s this year around infectious diseases and climate change, which I had the pleasure of helping to judge that contest. And I thought that was a really effective way of engaging hundreds of students and classrooms across the country in these on these topics. And I think there are ways to do it that sort of are clear and age appropriate, but still being sort of honest and bringing these important issues into the classroom. Because I know when I went through school, we weren't talking at all about infectious diseases and climate change. We were barely talking about climate change at all. And so I think that there is an importance of bringing that material into the classroom and maybe some more engaging and fun ways to do it.
Yeah, those are some great points. If anybody wants to see the winning posters, they're at cpha.ca/contest. And yeah, the grade 6 students were very creative. It was really interesting to see how they interpreted the climate change and health type messages. So we have another question here. Do you think the COVID-19 pandemic can be leveraged to make inroads to take action to prevent or slow humans encroaching on animal habitats and ecosystems? And does the COVID-19 lab theory distract from the zoonotic theory?
I'm happy to take a crack at it. You know, I think, you know, we're rewriting history in this moment. You know, we're re-looking at our relationship with the planet and each other in a way that we haven't done in, you know, certainly my short life on the planet. And I think there's a huge opportunity here to look at, you know, again, the zoonotic approach, you know, the impacts that we are having on ecosystems, the way in which we're interacting with species, and to come out of this with, you know, biodiversity and conservation and all kinds of things that are running alongside the climate crisis. The biodiversity crisis is equally important in our relationship with other species on this planet and how we interact with them, and the consequences of that in terms of, you know, infectious disease and whatnot. It's certainly an opportunity for us to kind of rethink all of this. And, you know, that's where I kind of hold space for that hope. And, you know, I think we've all had a moment of personal reflection. You know, do I need to be flying to that conference? Do I need to be kind of interacting in a certain way? Maybe I should be thinking more about my local food security, you know, with supply chains and all of these different facets where COVID has just really made us do a deep rethink. And in that way, I think the pandemic might save us from ourselves. We have to ask, you know, basic assumptions about the pillars at which society, you know, stands on and functions. And so I think that, you know, again, there is a huge moment here for COVID to have us realign in a different relationship with the natural world and with our human world and the way in which we've been living these fast-paced and unsustainable lives. And so I think there's great opportunity here, and the moment to seize it though is now. This idea that we want to return to normal, I think, is a very dangerous idea. Normal was very dangerous. Normal was very destructive. And so how do we return to something that's more balanced and more aware of these considerations?
Okay, that's some really good points there. We've just got a few more minutes, so we'll do one final question here. You spoke about the challenges around people feeling overwhelmed when we speak about climate change and health impacts. It's all interconnected, so how do we effectively communicate these interrelationships and still keep people engaged?
That's a great question. And that's sort of the question of our research. And so I can't give a full answer to that, but I can say so far from what we've learned in the focus groups, for instance, we saw that the connection between Lyme disease and climate change was quite confusing and quite sort of weak for some people. It didn't quite make sense of why we were connecting these two things. And so that has sort of led us to hypothesize in the context of this survey and the work that's ongoing, that perhaps maybe a broader frame of health when it comes to climate change. So thinking about a wider range of the health impacts of climate change and what are the impacts that stand to affect the most number of people, or the most people in a certain region, might be more effective for engaging people to understand these links, because we know that people are more responsive, of course, to impacts that they perceive might affect themselves personally or their family and their community. And so something like Lyme disease, for someone living in a city, maybe they don't go into the woods very often and they don't really see that they are at risk of this disease. So talking more broadly, perhaps about health impacts in general, and impacts that are more wide-reaching might be more effective. And yeah, I think another layer of it is sort of what Izzy talked about, is that we try to, in our materials, engage people, both give them the information in a plain way and in an honest way, as well as give them sort of some ways to take action or some reasons to sort of be hopeful and to see a path forward that isn't going to sort of paralyze them or make them feel kind of targeted or like doomed. So finding that balance, I think, is always hard, and finding ways to talk about taking action that are, match the scale of the problem is always like an ongoing challenge. And that's something that we talk a lot about in our work, is what are the actions, what are the pathways that we're bringing forward to give people hope, that are honest, that are that people can grab onto and be part of. Yeah, I don't know if anyone wants to add to that. It's a great question.
I was just going to say, on behalf of the team here and the larger Prairie Climate Centre, thanks for the opportunity to present on our work. I sent some links in the chat around the content, and we really look forward to, that larger conversation with colleagues from coast to coast to coast, and figuring out that good pathway forward.
And thank you to the three of you for presenting today. This was a really interesting presentation and a really great way to think about climate change and infectious disease, and how we do that messaging and communication going forward. So thank you for all your work and for joining us today. As a quick reminder to our attendees to please fill out our 5-minute survey once you close the window. It should pop up. We really appreciate your feedback, and it just helps us make these webinars great and more relevant in the future. So thank you very much for everyone joining today, and take care and stay safe. Bye.